Today we're going to be reading the label for Trazodone. This is to make sure that if you are taking Trazodone or if you're thinking of taking it, you have all of the most important information that you need to make the decision. I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist. I used to work at FDA and in multiple pharmaceutical companies doing drug safety and clinical research. First thing that you want to know about this drug is the boxed warning. And so all antidepressants carry a warning for suicidal thoughts and behavior. And that's because these drugs, like any drugs that act on the central nervous system, have a potential risk for a paradoxical side effect. So what does that mean? It means that instead of having the intended and often calming and anxiety reducing effect of these medications, they can make people more agitated. And when you make someone more agitated who's already depressed or they're having some kind of psychiatric issue, you can kind of push them towards suicidal behavior. A good analogy, I think, for this is think about a group of friends who sit down and they're smoking some marijuana. You might have 4 out of 5 of them have a very pleasant, relaxed experience, but one person in there becomes a little paranoid and then they don't want it ever again. That similar thing happens with any kind of drug that acts on the central nervous system. But Josef, you're saying, well, this is not an antidepressant. I'm getting Trazodone for sleep. Well, in fact, Trazodone is an antidepressant. It's a very old antidepressant that's not a very good antidepressant, and people never use it for depression now, but they use it for sleep because they found that it had a very strong sedative profile. And so the majority of Trazodone that's used to this day is for one-off or long-term use of insomnia. It's actually used off-label. So the next thing we're going to look at is that Trazodone is contraindicated in people taking monoamine oxidase inhibitors. This is only going to be relevant if you are an older person, because no one really uses this class of drugs anymore. These are things like Parnate. They're very old types of antidepressants. And so for most people, these drugs are going to be safe with the other drugs that they're taking. So let's look at some of the warnings a little closer. So we already mentioned the risk of suicidal thoughts and behavior. The next one is Serotonin Syndrome. And so you want to have this in mind if you're taking other serotonergic medications. So what might those be? Well, they could be any of the other SSRIs or SNRI medications, so Effexor and Prozac. It can also happen with the tricyclics, clomipramine, amitriptyline. This can also happen with some other drugs that you might not suspect. Things like tramadol. This is a synthetic opiate pain reliever, but also drugs like lithium and some antibiotics do it. This does not happen in all people who take this combination. In fact, I've seen people taking all of those drugs in combination and not developing serotonin syndrome. It just seems to be a rarer side effect that just happens to happen in some people with that combination. And so how would you recognize if you're developing serotonin syndrome? Well, a lot of people have what's called autonomic instability. Now, our autonomic nervous system is what regulates the things that are out of our conscious awareness, like our heartbeat, like our sweating, like our breathing. So what people who have serotonin syndrome look like is they have this very kind of erratic heart rate. It kind of goes up, it's very, very fast. They can sweat a lot. They can also have dilated pupils, and sometimes they get tremors as well. And so it's this full dysregulation of your autonomic nervous system. It's a medical emergency. You need to go to the emergency room straight away, and you need to stop all of your drugs, and the treatment is supportive, but it can be fatal in some people. Cardiac arrhythmias is also another risk, but this is a risk that's common to all of the antidepressants and all of the antipsychotic medications. A lot of them, in some people, tend to cause a slightly increased risk of cardiac arrhythmia. Some people are getting something called orthostatic hypotension or syncope. And what this means, it's when you stand up from a seated position, you get very lightheaded, and in the worst cases, you fall over. So when you're just starting this drug or when you increase the dose, just be a little bit more careful when you're getting up from a seated position, and just make sure that you're able to, that you're not getting too lightheaded. People usually get used to this side effect over time. It goes away. It's something that just happens at the start. There's also an increased risk of bleeding with any of these serotonergic antidepressants, which Trazodone is. They impair your platelets' ability to clot. And so if you're having bleeding problems, you may want to think about finding another medication to help you sleep. Priapism is a really interesting side effect because this one is actually unique to trazodone. This doesn't happen with the other antidepressants. And what this is a sustained erection that does not go down. This can actually be debilitating for some people. I mean, you can develop serious complications because of this, complications that could be damaging to your penis. And so if you develop one of these sustained erections, it's not like something to be excited about, it's something to go to the emergency room about, because they may need to perform a medical intervention to help the erection go down, and so you don't develop any of the serious complications that go along with that. The next one that you need to be aware of is mania. This is common to all of the antidepressants out there. In a select group of people, they can be very energizing for reasons we don't understand, and this can lead to you being misdiagnosed with mania. So if you take this drug and shortly thereafter, you become very disinhibited and agitated, it may not be because you have bipolar disorder, it may be because you're having an adverse reaction to trazodone. It causes a discontinuation syndrome. This is withdrawal. This is common to any drug that causes dependence, like any antidepressant. And so when you're coming off this medication, you want to withdraw it in a very gradual and steady way. If you want to know more about that, I have a lot of videos on my channel where I talk about the safe way to come off antidepressants. There's a potential for cognitive and motor impairment. That's because this drug is a sedative. It helps you sleep. And so right at the start when you're taking it, you want to make sure that you're able to drive. You want to make sure that you can really trust yourself before doing things where you could hurt someone if you had incoordination. Most people who take trazodone frequently complain of having this kind of hangover in the morning. So just be a little bit cautious in the morning until you get used to what that's like. And finally, the last two is angle closure glaucoma. So this is a visual problem. This is something that happens in your eye. Glaucoma is increased intraocular pressure, and this, if it goes unchecked, can lead to blindness. So if you're starting to have new visual symptoms and you've just started trazodone, you want to consider coming off this one. And finally, hyponatremia. This is common for all of the SSRI antidepressants, and it's where you get very low sodium, and this often makes you confused, and this can be life-threatening as well. And it's most frequent in getting who are over 65 years of age. This is why if you're taking a lot of these medications like antidepressants and things like that, you should really consider getting your blood, getting your metabolites measured, your basic metabolic panel, every 3 months, or maybe at most every 6 months. I'd say every 3 months would be the latest, because you really want to make sure that your electrolytes are within normal range. So who should take trazodone? Well, trazodone is actually a pretty good hypnotic medication because it's not addictive. People generally don't like taking trazodone. It's something that is very sedative. It helps them sleep. People generally don't like the hangover feeling in the morning. So I think using it as an as-needed sleep aid is really useful. If you were to take a medication long-term and you really needed to be on something chronically for insomnia, trazodone is much safer than being on something like Xanax, but it still carries a lot of risks. So trazodone is often the go-to for people who are having problems with insomnia.